Now we're going to have a conversation about palliative care, and with me this morning is the president of the Palliative Care Society, that is Satyemand Seemungal, and with me as well is a member of the society, Dr. Reatha Padmore. Good morning and welcome.
Thank you. Good morning.
All right, so there's a conference coming up. This is what installment of the conference?
It's the 7th.
7th, so it's been running for quite a while.
Yes, quite a while, yes.
And to outline the work of the Palliative Care Society. Could you inform us, President, what the Palliative Care Society does on a day-to-day basis?
Well, what happened, we are the functioning arm, but rather the administrative arm of the society. The society has a unit up at Khary, a palliative care unit. It's a 12-bedded unit, residential. And up there, once the person is suffering from life-limiting illnesses, the person becomes entitled to palliative care. And that is from date of diagnosis. So I think that is the difference between palliative care and hospice care.
Right.
We deal with from date of diagnosis and anything like cancer, cardiovascular diseases, renal diseases, dementia, anything like that. So we not only cancer, and our goal is quality of life and pain management.
So when it comes to that type of thing, it's really for those who, they are not able to do their daily functions on their own and they would need care continuously.
In some cases, yes. The patient that is, may not be well enough to live independently, and they may need a certain degree of medical or nursing care. So it may be appropriate to go to a palliative care unit, which is set up like a hospital. So it's staffed with medical doctors as well as nurses. But there's also an opportunity as well to receive palliative care in your home. And that also obtains here in Trinidad and Tobago.
Okay.
So we've got medical doctors in the community who are general practitioners who are trained, may not be specialized in palliative care medicine, but trained, so they're familiar with some of the, what we call the adjuncts to palliative care.
Right.
So we make available to patients who have that life-limiting disease, but choose to be in their own home as well, the opportunity to get medical visits, as well as a package of care that may include nursing, but also the psychosocial support for the family. So counselors, for example, are all part of the team as well as members of the religious
chaplain.
Yes, chaplains. Thank you.
So it's like a holistic approach to taking into consideration not only the individual who may need the care, but also, counseling for the family.
Absolutely.
And such. How does one access this? Say, for instance, I have a loved one who needs that type of care, but they prefer to stay in their own home. How does one access this?
As it is now, we don't have a formalized home care service. So it would have to be the general practitioner will have to contact our medical officer at Khary.
Right.
And arrangements can be made for the palliative care to be administered at home. But we hope in the near future to have a mobile unit where palliative care practitioners will visit the homes and thereby avoid people having to go to a formalized residential unit.
Right, so that I guess it would make it accessible, physically accessible to more people as compared to the confines of one place with limited space, obviously. All right, so let's speak about the conference, which is coming up. What date?
All right, our conference is on Sunday, the 6th of October, 2019, and it's being held at the Trinidad Hilton Conference Center, starting with registration at 7:30 in the morning and running for the entire day until about 5 in the evening. And our speakers include a host of local as well as international speakers, medical doctors and nurses, covering intensive care. We've got an anesthetist on the program, Dr. Khary Haran, Professor Khary Haran, who is one of the anesthetic consultants at Mount Hope Hospital in intensive care. Neil Nijawan is a Trinidadian as well, and he is the lead consultant in palliative care in London. So he'll be coming home with a colleague, Nurse Angela Vincent. And another headline speaker is Dr. Mani Brooks, who is Canadian-trained medical doctor with experience in substance abuse as well as pain management. And she will be speaking on the appropriate use of cannabis, as well as cannabinoids.
Wow, it's a whole other interesting topic you brought up there, for the management of pain and, some of these pain managing drugs that can be addictive as well. Well, that's a whole other topic that we can speak about another time. So, but I want to thank you for joining us this morning. So again, that is on this Sunday, Sunday 6th.
The first Sunday in October.
And it is at the
Trinidad Hilton.
Trinidad Hilton, and you could come in to get all the information. Make sure you come in and register from 7:30 in the morning. And
we have a early registration. If you register by the 30th of September, you get a $50 discount.
Oh, wow.
Yeah. And anything after that, you'll have to pay $50 more.
$50 more. So
and the conference is open not only to medical practitioners or people, caregivers and things. And members of the public can come in, because it gives you an idea of what palliative care is all about, and maybe equip you for what could come. Because with the emphasis now on NCDs, you'll probably find a lot of people living longer. Thereby, a lot more people will need palliative care.
Right. As quickly as their contact number, we can reach out.
Yes.
We also have a Facebook page, Palliative Care Society of Trinidad and Tobago.
On Facebook, Palliative Care Society of Trinidad and Tobago.
For online registration is palliativecSTT@gmail.com. For personal contacts, 223-7078, that is my number, 222-3781, and 622-8948.
All right, thank you.
Payments can be made at Bretton Hall, Suite 020.
All right, well, thank you so much, Satyemand Seemungal, President, Palliative Care Society. Thank you so much, Dr. Reatha Padmore, member and doctor as well.